yes, I'm one of the presenters for this like conference slash summit that you guys are having right now. I was asked by the MCP. But yes, so welcome everybody to YouthQuake and the Australian breakout room, and talking about how Australia responded to COVID as well. So before I get into it, I'll just quickly introduce myself. My name is Chelsea. So I'm Australian. I was born here in Australia, but I am half Vietnamese, half Chinese. And currently I'm the National Director of Marketing for AIESEC Australia here. And I'll be reterming again for next year as well. Cool. So, and of course, feel free to ask any questions throughout it as well. And we'll also have a Q&A space at the end if you guys have any queries or questions. But yeah, so basically I think the main things that we'll be looking at today. So as you guys know, this whole summit is to look at a global response as to how different entities kind of dealt with COVID, or how can we develop cross-cultural understanding within multiple different nationalities. So basically what we'll be looking at today is just the context of Australia, how Australia dealt with COVID and how young people have responded as well. Just a quick question before we start, has anybody been to Australia, or do you guys know much about Australia, or what's the biggest thing you guys know about Australia, if anything? You guys can type it in the chat, or say it out loud as well. Anything at all. Or if you don't know anything about Australia, that's also cool. Nothing? All right, cool. No worries. I think Australia is pretty isolated, and especially we're so far from Sri Lanka as well. So I don't expect many people to know. But I think the biggest thing is that we have kangaroos here. So there you go. Australia, big cities are Melbourne, Sydney. That's very true. I'm actually in Sydney right now. So yes, those are our two most populated cities. And there's a lot of kangaroos. Okay, there's kangaroos in the desert and the bushes, but not in the cities. So that's not a common thing. Okay, but yes, we do have kangaroos. We have lots of beaches. That's also true. Oh, I love the Australian accent. Oh, so nice. Okay, cool, amazing. So I think just heading straight into it, to give you guys a bit of context. So Australia's population is 25.3 million. So even though we're quite a large continent, we actually don't have many people here in comparison to other countries. Our capital is in Canberra. So this, if you guys see it here, this little tiny dot is where our capital is, which is very ironic, seeing as this is the biggest state and not the capital. And our official language is English, even though we have multiple different nationalities and ethnicities which reside in Australia. Cool. So I think just go into the COVID situation, how we dealt with it. So our total cases, surprisingly, was only 29,900 cases, and our deaths have reached around 910, so still less than K. And as you guys can see here, it mainly peaked, of course, when COVID first started. So back in March last year, and then it peaked again because we had a second wave during August to July. But ever since then, as you guys can see, it's been quite low, and we pretty much dealt with it the best that we could. And actually, life here has pretty much gone back to normal, except of course social distancing and masks, but we're still able to go out. We've been able to go back out to clubs and parties and all of that. So yeah, I think we're very, very fortunate and very privileged as well. And I will get into how Australia was able to deal with that, and what young people did, or how the community responded. And so far as well, our vaccinations have reached 3.1 million, which is of course not bad, but I think if you compare it to other countries, or other countries higher populations, it's still quite low, and it hasn't gone as fast as it could have, especially with at the rate with how things are going right now. Cool. So I think just go into how did Australia respond to the COVID-19 pandemic, and how do we actually respond to everything that was happening. So there'll be three main things which I'll be going through today. So this is just a timeline as to how things look like. So I'll just give you guys a quick brief TLDR. So back in January 2020, we had our first Australian cases reported when the pandemic first started, and then we kind of heard that there was a new virus going around. And then back in February 2020, our Prime Minister Scott Morrison, he and the government, they activated a response plan in order to kind of deal with COVID and what Australia should actually do. And then in March 2020, as you guys can see, a lot of things like happens. It's kind of like one after the other. So I'll start at the bottom first. So back in March, the first Australian death was actually reported. It was a traveller, an Australian who arrived back from Australia. And then also in March, we had the first cases of community transmission. Before this, it was all just like return travellers overseas. And then of course, as you guys know, back in March, the WHO officially declares COVID-19 a pandemic. And then our government responded by giving an economic stimulus to those who were put out of work or who weren't able to go to work anymore. And then things kind of got a bit more intense. So lockdowns were implemented. I'm sure you guys are all familiar, having to be at home, can't go out, can't see people. Our borders were also closed to people who weren't Australian like residents or citizens. And then schools and non-essential works was closed as well. So I remember my sister, you know, she's like in grade 11. She had to stay home from work. She couldn't go anywhere. And I had to also stay home and like do AIESEC at home as well. So like the whole family was just, you know, at home. And I'm not quite sure if you guys saw on the news or like if it happens over there as well, but people were panic buying toilet paper. Like out of everything you can panic buy, people were just buying toilet paper. So, you know, my family was just out, like we legit needed toilet paper, but like there was none left. And I'm just like, oh my God, what is happening? People were going crazy. And then April, fortunately, because of the lockdowns and all the restrictions, our cases actually started falling down. So we weren't getting as much anymore. And our government actually introduced a COVID safe app. So this was an app where if you went out to like a restaurant or like any like public setting, you had to scan a code and to kind of like log in and to show people where you actually went. So that if there were cases or a breakout, people can kind of trace you back to where you went and then make sure that they were able to contact all the close contacts. And this is still something that we still use to this day. And then back in May 2020, the government introduced a 3-stage plan to bring Australia out of lockdown. So as you guys can see, our lockdown was like only for 2 months at max. Everything started to slowly get back to normal after then. So we're very, very fortunate and privileged as well. But how did this actually all occur? Like how, you know, was the community able to actually like bring us out of lockdown and like actually follow all the rules? So I think the first thing that Australia did was that we acted very quickly and decisively based on data. So what this meant was we actually closed international borders pretty much immediately, and we actually implemented a mandatory isolation program for returning Australian citizens. So if you're an Australian citizen coming back home from overseas, you had to stay in your home for 2 weeks and not be allowed out. And police were actually dispatched to these homes to make sure people actually stayed home. Because there were some people who like would not, right? They would just go out and I don't know, go parties, go buy stuff, which is just like so stupid, to make sure that there were no breaches. But of course, that is like not foolproof, right? People still went out. So what we did was that we moved to a mandatory hotel quarantine system. So in every single state in Australia, if you're a returning citizen coming back to Australia, you have to go into hotel quarantine for 2 weeks, and you get COVID tested, and they give you food and everything, of course, but you of course can't leave because there's military and police guarding the hotel and the rooms. And also another thing is that each state actually shut their borders. So we have 6 states and 2 territories here in Australia, as you guys saw on the map there. Like every single one pretty much shut their borders out. We couldn't travel to another state for quite a few months. And if you did, you had to declare where you've been, and you had to actually do like isolation as well for 2 weeks. So it's pretty intense. Travel was like, you know, restricted overseas, but also within Australia. But yeah, that was the first one. Next one is that next like kind of learning, I guess, is that social capital builds trust amongst people. So what do I actually mean by this, right? So what happened is that the government introduced, if you guys remember, like an economic stimulus package where they paid fortnightly wages of 1,500 AUD to employees, such as like hospitality workers or like retail workers who weren't able to work because of lockdown. Because during our lockdown, lots of small businesses actually closed, and of course that affected, you know, people's well-beings and like the economy quite a bit. So the government came up with a way of how do we actually help these people still survive and get back to their jobs afterwards. So they paid this much during the program, and this program is still actually ongoing. The amount is not as much, but it's still ongoing to help people still like survive during this crisis. And it provides like a lot of unemployment benefits. But of course, like this only worked with like consistent and clear communication to actually build confidence in like what we were doing, right? And of course, like build compliance with the public. And surprisingly, like most Australians actually didn't protest wearing masks. I know I see like a lot of protests like in other countries, people aren't happy, but more or less it was still pretty okay here. And yeah, like the ratings for leaders actually went up during this time, and Australia played quite a like vital role in kind of coming up with like the vaccinations or like helping like mitigate this whole pandemic in the first place. So we had accessible healthcare, but of course it needs to be paired with like a lot of social support, right? Like people actually need to know what you're doing, why you're doing what you're doing in order to actually buy in and actually like listen to you in the first place. Yep. And I think the last one is like engaging with like different communities to see what they kind of need. So in Australia, we have like lots of Indigenous Australians who are the first owners of this land. And like they have the worst health outcomes, right? They have a life expectancy of 8 years fewer than non-Indigenous Australians. And of course, when COVID struck, they wanted to run their own, campaigns to respond to the government, and this actually worked. They were 6 times less likely to contract COVID, and there were actually 0 deaths within the Indigenous population, which is a very, very like good result for us because they're usually the ones with like the highest deaths in the community, and only 15% of them were hospitalized. So that was something we wanted to really keep to try and help like these much more like marginalized communities. And of course, with like the easing of restrictions, so like what actually happened here was that we flattened the curve quite well. The new number of cases these days, we have no more community transmission. All the new cases that we have come in are like from overseas travelers who have to go into hotel quarantine. And basically, like I said before, back in May 2020, the government came up with like a 3-step plan to remove restrictions until June. And of course, right now as well, how we're living is like still, I'm sure you guys are familiar, we still have to stay 1.5 meters away from each other if we can. We have to, maintain good hand washing. We have to wear masks as well. Like it's not mandatory anymore, but we have to wear masks, stay home when you're unwell, and yeah, of course, still download the COVID Safe app, which we still use everywhere. But yeah, that was pretty much just like a short little keynote on how Australia dealt with COVID. I think it's time for you guys to move to other breakout room, but I hope you guys learn a bit and yeah, know how Australia kind of works. Thank you guys. Thank you. Very multicultural and diverse here. Cool. So basically, just to give you guys a bit of context, so our total cases for COVID in Australia ever since the outbreak first occurred is 29,900 cases, and our deaths have resulted in 910, so less than 1,000 deaths. And as you guys can see, it peaked here, like of course when the outbreak first started, and back in like August to July last year as well, when we had like a second wave of cases. And so far, we've had 3.1 million doses of the vaccine. Of course, if you compare it to other countries, it's quite low, but in comparison with like the amount of like population we have and how many people are here, this is like in relation to it as well. So that's just some context so you guys understand a bit more as to like where Australia is and like how we kind of dealt with COVID. But pretty much like how do we actually respond to the COVID-19 pandemic, right? How do we actually get to this place right now? Because if you guys don't know, we're actually quite like lucky and privileged. Life has pretty much gone back to normal. There's no lockdowns or restrictions. We don't have to wear masks. So I'm very, very lucky and grateful that we were able to respond the way that we did. But how do we actually do that, right? So just to give you guys a quick timeline as to how it was like. So back in January, our first cases were reported. And then in February, our Prime Minister, Scott Morrison, activated a response plan with the government as to how to actually respond to COVID. And then in March 2020, so as you guys can see, a lot of things happened in March. So our first Australian death was actually reported. He was a returning traveler from China. And then our first cases of community transmission were reported as well. And then after this, as you guys are familiar with, the WHO declares COVID-19 officially as a pandemic. And then our government introduced some economic stimuluses to make sure that people were still able to survive when they didn't have any work. And then more things happened. So as you guys can see, lockdown was implemented. I'm sure you guys are all familiar. Nobody was able to leave their homes. We couldn't go out to play or, go meet our friends or anything. We were just stuck at home. Our borders were also closed, international borders. So if you weren't an Australian resident or citizen, you couldn't come to the country, and schools and non-essential work was closed as well. So, I remember I was at home doing work, and like my sister had to be home because she didn't go to school. It was all closed. And then in April, actually, our cases started falling because of the lockdown. So because people weren't able to go anywhere, our cases weren't as high as before. And the government introduced a COVID safe app. So this is an app we still use to this day. So when you go out to a restaurant or like, any public setting, you have to scan a code on your phone so that it tracks where you are. So that if any cases were to occur, people will know where you have been and be able to contact you so you can isolate. And back in May 2020, the government introduced a 3-stage plan to bring Australia out of lockdown to kind of get our lives back to normal. But how did this actually all work, right? Like, how was the government actually able to introduce all these things, and how was Australia able to get back into normal life so quickly? So there's actually 3 things which I want to highlight today. So firstly is that we acted very quickly and decisively based on data. So like I said before, we responded quickly. The government closed international borders pretty much immediately, and we had to implement like a mandatory home isolation program for all Australian citizens. So if you were an Australian citizen coming back to Australia, you had to isolate at your home for 2 weeks, and the police will actually check up on you to make sure that you were there and you weren't, going out and about in the community, because we actually saw people did that. But of course, because we saw that people did that, we stopped doing the home quarantines, and we made a mandatory hotel quarantine system. So if you return to Australia, you had to go into hotel quarantine for 2 weeks, and the military and the police will be guarding your room and the hotel to make sure you won't leave. You'll get like 2 COVID tests as well, and you will get food delivered to you. Pretty much you can do anything except you just can't leave for your room. And that is still something that we implement to this day as well. I think the next point that I kind of want to highlight is that social capital builds trust amongst public. So what this means is that the government actually introduced a plan, fortnightly wages so they paid people 1,500 AUD every 2 weeks for like hospitality employees, for retail workers who weren't able to work anymore because their job had been cut because of COVID. But of course, to keep the economy going and to help these people like get their jobs back as well, the government introduced this package. And it provided like unemployment benefits. And of course, with like consistent, clear communication, this built like a lot of like confidence in the government as well as to like how to respond to COVID. And like surprisingly, very few Australians actually protested wearing masks. They were actually quite happy with it, and approval ratings actually like went up quite high as well, even for the different types of leaders. So there was like a lot of buy-in. People were actually, going with the flow. People were actually, sticking to like social distancing and wearing masks and staying home as well. And then the last thing is that the government was able to engage with different communities to see what they needed. So if you guys don't know, Indigenous Australians, they are like the first people of this land, right? But of course, they're very like marginalized, and they don't have a lot of representation in society. So and they actually, because of this, they have like the worst health outcomes of any other Australians, with like 8 years less life expectancy than other Australians. But of course, like, when COVID struck, they insisted that they run their own campaigns to kind of deal with the response themselves, and the government listened. And this actually proved quite valuable because there were 6 times less likely to contract COVID, and there were actually 0 deaths within the Indigenous population. And only 15% of them were hospitalized. So in comparison to how it is normally in society, I think this was quite a good response, especially from the government, like listening to these Indigenous people, Indigenous Australians, and like giving them, food, water, and like necessary supplies to their own like communities as well. So like I said before, because of all this, Australia's actually kind of gone back to normal. We're able to go out, there's no masks required. We're still able to like travel within Australia as well. And we're able to have easing restrictions, right? Right now, we have had no new cases, no community spread, except for like returning travelers coming overseas. So it was quite good in suppressing the virus. And like I said, back in May 2020, the government agreed to like a 3-step plan to remove restrictions and to get life back to normal as well. But of course, as you guys know, this is still how we live our life right now. We have to still try and stay 1.5 meters away from each other. We have to maintain good hand washing, wear masks if you're sick, or just don't go out at all. Stay home when you're unwell, get tested if you have any fevers or symptoms. And we still use the COVID Safe app today, and we still download it. And make sure we check into every single place that we go. But yeah, that was pretty much like how kind of Australia dealt with COVID. I think, like I said, I'm very, very privileged and grateful to be here. We don't take that for granted at all. And we're just like lucky that we're able to live as a normal life as we can. But yeah, that was all from my end. Thank you so much, everybody, for coming to this breakout room. You guys can ask questions you have or go back to the main breakout room as well. But yeah, thank you guys.